This is our calendar of events. We have our monitorings that are coming up, and it indicates when it is and if it's full.
Floridians die every day from an opioid overdose, and those numbers are climbing. So we are losing Floridians at a rapid pace. When these individuals die from overdose, oftentimes they are leaving children, and oftentimes the children are then placed with grandparents, and grandparents are, of course, love the children, but are often ill-equipped to or unable to raise them. So if they can't find a relative placement, for example, they oftentimes come into the child welfare system. And since this opioid epidemic, there has been a 30% rise in children entering the child welfare system. Between 1991 and 1997, Big Pharma, some of the big pharmaceutical companies, were coming up with some very potent pain relievers. And these drugs were touted to physicians. They were told that they were not habit-forming and that they would really, really address their patients' pain level. And so our physicians began prescribing these drugs. You may have heard of oxycodone and OxyContin and so on. Then there was a real push in the mid-2000s to shut down the pill mills, because there was now the understanding and realization that these pain medications indeed were very, very addictive. People were selling them on the streets. A lot of very negative things happened as a result. And so states began to really clamp down, began to monitor drugstores on who was receiving these medications, if they were doctor shopping, etc. So the supply shrunk as a result of these regulations and legislation, but these folks were still addicted. And so, unfortunately, our folks that deal drugs saw an opportunity, and they decided that they would push heroin. They would reduce drastically the cost of heroin because it has the same components as the drugs that the folks were addicted to.
That's scary stuff.
It's very scary. And so when the folks that were addicted lost their supply, they then turned to the streets to get the same type of high, if you will, that their former drug was giving them. Now they are addicted to heroin.
We're visiting LSF Health Systems, and we want to know what you do for this wonderful team.
Hi, well, I am the Director of Program Operations, which means I oversee all things clinical. We serve 23 counties, and so we have 50-some providers that we look at quality of care for their services. In addition, we do care coordination here, and we work with high utilizers in the system who are living in a state of crisis or at the state hospital, and we link them in the community so that they can live stable, productive lives.
Well, I'm the Chief Integration Officer, and what that is, I primarily focus on child welfare integration, and that is taking behavioral health services across our Northeast region and building relationships between the providers, the Department of Children and Families, and the community-based care child welfare programs to make sure those families are getting the right services. The clinical department works under me and with me here. The training department does that, and so those are my primary responsibilities.
We have a helping hand, make sure that everything is functioning flawlessly, make sure that they are up to date with the knowledge that's going on, make sure that their money is working fine, troubleshooting any issues, just being that voice of reason to make sure that everything is functioning nice and smooth.
How many providers did you say you had, Christine?
We have 50 providers, and they span 23 counties. They're outstanding, and again, we provide all the services for the indigent and uninsured individuals in those 23 counties that have substance abuse and/or mental health disorders.
So for LSF Health Systems, it means that we're able to provide the best quality service in terms of training, developing the curriculum, organizing the most evidence-based training across our state. And so we work with our families and our providers, utilizing those evidence-based practices to bring better quality services to our area.
We name all of our amendments and contracts by music bands. So our upcoming update is the Queen, so that'll be for next fiscal year. We also do the quote of the week, and I think Elizabeth does this weekly. So we put encouraging words on there.
My name is Carl Falconer. I'm the Regional Director of Soarin' Housing Initiatives here at LSF Health Systems. And what we do in our department is we help people find housing, safe, affordable, secure housing. And we also help them apply for SSI and SSDI benefits, which also comes with Medicaid and Medicare. So what we like to say is that we help people recover from substance abuse and mental health issues by providing them affordable housing, safe housing, and benefits and income to be able to sustain that housing.
We have a program called Project Save Lives, and it is a partnership with St. Vincent's Hospital, Gateway, one of our provider organizations, River Region, Jacksonville University, and of course LSF Health Systems. And
Those are some big partners.
Absolutely, and they're great partners. And we created this pilot to address the issues of when folks come into St. Vincent's emergency room. We're using peer specialists because we believe that peers are the linchpin for helping individuals get motivated to go into treatment. So as soon as an individual comes into St. Vincent's in an overdose status, the peer specialist is the first person that individual sees and works with, while the rest of the clinical team is working with any family members that may be present. The goal being, let's not let that person that's overdosed and been revived, let's not let his or her feet hit the streets. Let's get them into treatment immediately so that we can stop that cycle and get that person the help that they desperately need.
And I understand that you were nominated as a finalist for the Sapphire Award, which is a very big award and one that recognizes leaders in health. So I just want to say congratulations.
Thank you very much. I'm so surprised and very humbled by this, and I can tell you I couldn't do it without the dream team here at LSF Health Systems, the rest of my colleagues at LSF, and I'm just honored to be able to represent LSF in this very special honor.
Well, thank you. Thanks for your time today.
Thank you so much.